organizers of this wonderful congress, all the dignitaries of the dais and respected audience. At the outset, I welcome all of you for this conference. I think in Kerala it is being taken for the first time. Acupuncture is supposed to be a part of traditional Chinese medicine. But I am happy to tell you that even in China, during my press conference, I have claimed that acupuncture is Indian in origin and the roots of acupuncture are in India. It spread to China from India. In 1995, there was one international congress in China and I was awarded as the best speaker. Then I had a press conference. The lady who was interviewing me, she said, Professor Lohya, we are thankful to you that you are popularizing Chinese medicine in your country. I said, sorry madam, rather I am thankful to Chinese government and Chinese people for having accepted my Indian medicine in your country. It was 1995. Let me tell you that I am an allopathic doctor. I had a maternity and surgical home. My practice was very good. So wherever I go, people ask me, when you are a leading allopathic doctor, why you have switched to acupuncture? See, all pathies are good. They are for the benefit of the human being. But each pathy has got some limitation. As each coin has got tail and head, each pathy, maybe allopathy or acupuncture or homeopathy or ayurveda, there are two sides, one side of limitations and the other side of indication. No science is complete. In one of international press conferences, I was asked a question, which is the best pathy? Probably they expected that I will say allopathy or acupuncture. I said, neither allopathy nor acupuncture, but curopathy is the best pathy. And it may vary from person to person. For some person, Ayurveda may be good for his disease, some other person, allopathy may be better, for third, acupuncture may be better. Now, what is the specificity of acupuncture? Why I have come to acupuncture? I earned lot of money in allopathy, but what I could not earn was mental satisfaction. Because in allopathy, medicine branch is lacking. For 90% of the disorders, we don't know either the root cause of the disease or we don't have a remedy, so we keep on suppressing the symptoms. And patient has to take the allopathic drug throughout the lifelong. In acupuncture, the beauty of acupuncture is, if the acupuncturist is expert in the various cycles of 5 elements, pulse diagnosis, tongue diagnosis, nail diagnosis, iris diagnosis. In majority of the so-called incurable disorders according to modern medicine, an expert acupuncturist can definitely find out the root cause of the disease and treat. So diseases like say bronchial asthma or hypertension or diabetes, whatever, a long list of so-called incurable according to allopathy. They can be completely cured provided we can find out the root cause. जैसा जड़ से निकालने का, बीमारी को जड़ से निकाल सकते हैं in acupuncture. In allopathy, except bacterial infection, we are rather helpless. Then, as compared to expenses, acupuncture is definitely far more economical than allopathy or other systems. Nowadays, modern medicine has become too much costly for a common man. And remember, in India, lot of population is living below poverty lines. We are a developing country. Common Indian man cannot afford the costly investigations and costly drugs which we give in allopathy. Acupuncture is far more economical. And in acupuncture, there is a branch which is acupressure, all of you know. If patient is poor, if the disease is minor, patient can himself or herself treat by pressing particular acupressure point. This is another plus point in acupressure. In India, I have conducted more than 1,000 lectures of acupressure for common man because we have to popularize it. It is our moral duty that we should be useful to a common man. Money everybody can earn, but this is our duty. We should spread science of acupuncture as acupressure. Many people believe, they ask me कि without drug, how can you treat? Because clinic is named as Dawa Khana. Dawa means drug. Khana means eating. And in acupuncture, neither there is Dawa nor we are doing any Khana. When I started acupuncture long back, 40 years back, people used to come and see whether I am dipping the needle in some medicine and taking it. Because it was difficult for people to believe that a disease can be treated without drugs. Now coming to acupuncture, by and large, pain and paralysis are due to obstruction in the meridian. So we have to find where is the obstruction in the meridian. Whenever there is obstruction in the energy flowing in the meridian, the energy stagnates prior to obstruction. At that point, there is Ashi point. Ashi point means point which is painful on pressure. वहाँ दर्द होता है. And the area distal to obstruction, the area which is not getting proper energy, there may be paralysis, there may be tingling, there may be numbness, there may be weakness, or there may be loss of action to that part. This is regarding pain and paralysis. And when it comes to systemic disorders means disorders of the heart, liver, kidney, lung, eye disorder, nose disorder, skin disorder. These are called systemic disorders. These disorders are due to imbalance in the 5 elements. So we should be, if you want to be expert acupuncturist, you have to be expert in diagnosing according to imbalance in 5 elements. There are various factors, overacting, counteracting, this and that. All of you are acupuncture is doing. So in systemic disorders, we can find out the root cause of the disease, find out where is the imbalance, we can correct the imbalance in 5 elements and we can cure the disease. And then coming to infections, infective part. In infections, in allopathy, we are giving antibiotic. What is meaning of the term? We are giving whatever antibiotic we are giving, that is against the life. It is not specified that it is against life of bacteria or virus. It is against life. If you take in low dose, it may be against life of bacteria. If you take in high dose, which the patient cannot tolerate, it may be means against the life of the person who is consuming. Now, in acupuncture, we can treat all the infections by increasing the immunity of the person. Why there is infection? There are 2 things. Number 1, either the bacteria or virus is very strong, very high, or bacteria is not high, but your immunity is low, because normal bacteria is also acting in your body. By the way, for your information, Maharashtra government has appointed me as member of COVID task force. What we did? In acupressure, there are certain points you will be knowing. DU14, DAZUI, LI11, stomach 36, LI4, spleen 6. There are many points which even with acupressure they can increase the point. So for Maharashtra government, I had prepared a video showing these points, how to fix a seed at the point with a paper tape and how to do acupressure at these points. And Maharashtra government widely circulated this acupressure video throughout the state of Maharashtra, and it was definitely useful for common man to prevent a corona or other similar disorders. If disease is at the early stage, we can prevent, we can increase the immunity, we can prevent or treat minor ailments with acupuncture. In acupuncture can also be used as a painkiller. It has been scientifically proved that action of acupuncture is better than morphine, which is the best. It is equivalent to morphine or bit better. Morphine is very strong analgesic drug which is used for cancer pain or for heart pain. So acupuncture is as strong. Analgesic action of acupuncture is as good as morphine. In China, acupuncture was being used for acupuncture anesthesia. I have seen major surgeries being conducted in acupuncture anesthesia in China. In my own hospital, I told you that I had allopathic hospital, I was operating. In my own hospital, we used acupuncture for analgesia, this anesthesia. Acupuncture can also be used for extracting the root. There are many causes. All of you are acupuncturists, I don't have to tell. So now, in brief, what I want to tell you that it is our moral duty as acupuncturists to spread this wonderful science throughout people. Particularly, you should organize acupressure lectures. Keep common diseases, how to treat common diseases with acupressure. Common problem. So people can save their money. People can. In China, why did they popularize acupuncture? Because President Mao, he thought that if a drugless therapy like acupuncture is popularized in a country like China, Chinese government would be able to save the money being spent on import of allopathic drugs. So they popularized. Initially, when I went to China for the first time around 1983, China was a very poor country. But now, China is a very good economically stable country, and I think, according to me, acupuncture has a big role in the development of China. Same thing we want to happen in our country. We have to spread the science and see that people can save their money. So acupuncture can treat a wide range of disorders. Commonly, the disorders which we are getting are pain and paralysis. We can avoid knee replacement, we can avoid hip replacement, we can avoid. By the way, in Corona, lot of steroids were given to people and many people damaged their hip joint. Very common side effect of coma because of steroids. Hip replacement was very common. So we can use acupuncture for avoiding hip replacement, knee replacement. At our center, we are using acupuncture to treat heart disorders, to avoid bypass surgery, to avoid angioplasty, to avoid kidney transplant. We are working at a very high level. I have clinics in Delhi, Mumbai, all over, and I am visiting professors in many countries. I am happy to tell you that many so-called incurable disorders can be curable with acupuncture. And one last word. Everybody, including Dr. Lohya, is a student of the science. Though you call me professor because I know a bit better than you, but still I say, I am a student of acupuncture. Learning has no end. Throughout life, we have to learn and see, because every day you may find some new case, new disease. By now, I have examined more than 30 lakh patients, and I have seen a wide range of diseases which I never saw before. Rare disorders. Recently at Delhi, I saw a lady having only half ovary and half uterus. I have seen 4 people so far, 4 female, who did not have vagina itself. I have seen a boy who did not have sternum bone. I have seen a boy who did not have hip bone. So there are a wide range of patients. Every day there may be a chance that you are seeing something new. So keep on studying. Keep on studying. And secondly, when you are thinking of acupuncture, don't view from the angle of allopathy or any other pathy, because each pathy is looking at the patient from a different angle. So, say I am allopathic doctor. When I am practicing acupuncture, I have to forget that I am doctor of allopathy. Otherwise, I can't believe what I have done. I have treated many cases of tumors with acupuncture. As an allopathic doctor, I can't believe what I have done. view. So when you are doing acupuncture, forget your own pathy, think that you are acupuncturist. See, if you ask a person from London, you want to go to Mount Everest, in which direction you should travel, he will say you have to go to east. On the contrary, if you ask a person from Japan, where is Mount Everest, he will say you have to go to the west. Both are correct from their angle. Both are correct from their angle. So angle of each patient of looking at the patient is different. So when you are practicing acupuncture, think only acupuncture and only acupuncture. I am very thankful to all of you for calling me, inviting me here. It was a wonderful journey. Thank you very much.